Hello, today we're going to talk about the Kirby-Bauer disc diffusion method, and this is a method where we can test the sensitivity or resistance of antibiotics. And in this method, we have a few things that we need to keep in mind. Number one, and mainly, that it is very highly standardized. And it's standardized with relationship to its pH, 7.2 to 7.4. Also, the type of media that we use is called Mueller-Hinton agar or MHA, and the thickness that we pour it is 4 millimeters. This thickness is important because we want to reduce the diffusion of the antibiotics into the media to reduce the risk that they'll overlap one another. The bacterial concentration is also very important, and we use the McFarland standard to make sure that the bacterial concentration is not too concentrated, too dilute. And we must use our bacteria within 30 minutes or so, because bacteria that we're using today have a tendency to replicate every 20 to 30 minutes. So you need to make sure you do this quickly. And lastly, the antibiotics. Each antibiotic does have a specific concentration to it, and we have to make sure that we use the appropriate concentration for this test. Now, one of the things that we will be looking at after we actually do set the plate up is we have to measure what's called the zone of inhibition. And the zone of inhibition is the clear area around the antibiotic disc where no bacteria will grow. So there are some types of antibiotics that are called bactericidal. Those kill the bacteria, and some are bacteriostatic, and those just inhibit the growth. So next time, after we take a look at these plates, what we will see is this nice clear zone. Here's the disc in the middle. We measure that in millimeters, and then we compare this to a standardized chart. And the chart that we have will have 3 different rows that we're interested in. One is for resistance, intermediate, or susceptible. If your zone falls within the resistance zone, you will say then that the bacteria is resistant to that antibiotic. If it falls within what we call the sensitive or susceptible zone, that means that this antibiotic can be used to treat a patient because the antibiotic is actually killing or inhibiting that bacteria.